Now, let's get right to the big story. And it's something that a lot of you are talking about. Governor Brown's vaccine mandate and the healthcare workers across the state willing to walk away from their jobs instead of getting the COVID vaccine. Hundreds of legacy hospital employees will be put on paid administrative leave starting tomorrow unless they get the shot. Our Cristin Severance talked to employees willing to do that, to lose their jobs over this, and the legacy administrators who are still holding out hope that their workers will get the shot.
So you are in the ICU?
Yes.
Joseph Steininger is a certified nursing assistant at Legacy's Meridian Park Hospital in Tualatin. He's been a CNA for 14 years.
I love being able to help people get better and help brighten their days and be able to be there to help the nurses.
A job he's about to lose. Joseph is not vaccinated against COVID-19 and does not plan on getting the shot. He said it goes against his religious beliefs.
Why does this go against your religious beliefs?
I have a very strong conviction that if I feel like I should not put something in my body, I shouldn't do it. That goes for marijuana, that goes for alcohol.
How do you prove that this is somehow religious and not just how you feel inside?
Well, in Romans, it talks about not eating anything that goes against your conscience. And that would be similar to injecting something into your body.
Under guidance from the Oregon Health Authority and Legacy's own policy, healthcare workers must get vaccinated or provide a medical or religious exemption. Joseph is one of the hundreds of Legacy employees who had their exemption request denied. They received an email Monday saying they would be placed on administrative leave Friday unless they get the shot.
It's like, that doesn't make any sense. Like, it says that they had a panel that looked at them all individually, but they can't give me an individual response.
The Oregon Nurses Association put out a release saying Legacy did, quote, blanket vaccine exemption rejections. They said 18 nurses at Legacy Silverton Hospital, nearly half the staff in that department, are facing termination. But Keisha Kelly, Senior Vice President and Chief Nurse of Legacy Health, said ONA is wrong. She said each exemption was reviewed by a panel of people.
I'm actually saying that is not true. What we actually did do is we looked at every individual case. And it may have felt that was a blanket denial because we did have to notify a lot of individuals that they did not receive those exemptions. But it was all out of our commitment to patient safety and wanting to make sure that our employees had time to make an informed decision to get vaccinated.
I also talked to the Oregon Nurses Association Communications Director Scott Palmer and Board President Linda Pond about this.
I asked them, did they do a blanket denial, specifically at the hospital you mentioned, and they said no. They reviewed each and every exemption form, and this was not a blanket denial process. What do you say to that?
That strikes me as a little surprising, frankly, because our staff on the ground at Legacy Silverton have not heard of a single nurse who has submitted a religious exemption and who has had that exemption approved. It sounds to me like that's kind of the definition of a blanket rejection. Obviously, we believe that there are some cases in which those exemptions should be treated seriously and should be granted.
ONA said the bigger issue here, not just the workers losing their jobs, but the added stress and workload placed on the nurses left behind.
And what I really want to stress is that it's not just the mandate, that it is the actual impact of COVID. It's the actual impact of short staffing consistently by hospitals over the past 10 years, and nurses have just reached their max.
Remember, this is all happening during a nationwide nursing shortage. And while Legacy officials are still holding out hope, the remaining unvaccinated workers will change their minds. Many, like Joseph, are ready to walk away.
I will lose my job over this if it doesn't change, yeah. So
you will not get vaccinated. You'll find somewhere else to work, something else to do.
Yeah, I mean, at the same time that I believe that I'm not supposed to take this vaccine, I do believe that God will provide another way.
Legacy told me that they are using contracted workers and they've slowed down scheduling some of the elective surgeries at their hospitals to deal with the current staffing issues. They've also had to temporarily close some of the Legacy Health Go clinics, and they don't know how long that will last. This story is developing. We are learning new things every single day, and we will continue to keep you updated. If you have questions, comments, let us know using that hashtag HeyDan.